morning, everyone. We will be discussing speech disorder. Today, we will be learning things about speech disorder, particularly its definition and classifications. We will also discuss its prevalence rate, teaching strategies, and educational programs that addresses this disorder. We will also have one research study about speech disorder and will share its findings. Speech and speech disorder. Speech refers specifically to sounds produced by the oral mechanism, including the lips, tongue, vocal cords, and related structures. Speech disorder. It refers to the problems in producing the sound of speech or with the quality of voice. People with speech disorders may not say words or sounds clearly, have a hoarse or raspy voice, repeat sounds, or pause when speaking. Language disorders are distinct from speech disorders. Language refers to the code or a system of words and symbols written, spoken, or expressed with gestures and body language. It is used to communicate meaning and for transforming unobservable mental events, such as thoughts and memories, into events that can be perceived by other people. Language disorders are an impairment of either understanding linguistic information or receptive language, or the ability to use and share linguistic information, the expressive language, and are not related with speech production. Classification of speech disorders. First, speech sound disorders. It is a speech disorder in which some speech sounds, called phonemes, are either not produced correctly, or not used correctly. Organic speech sound disorders results from an underlying motor, neurological, structural, or sensory perceptual cause. The other one is functional speech sound disorders are idiopathic, they have no known cause. So these are the two underlying classifications under this speech sound disorders. The next one is fluency disorders. So fluency is the aspect of speech production that refers to continuity, smoothness, rate, and effort. So fluency disorders are difficulties with the rhythm and timing of speech characterized by hesitations, repetitions, or prolongations of sounds, syllables, words, or phrases. Voice disorders. Voice disorders are problems with the quality or use of one's voice resulting from disorders in the larynx. This is characterized by abnormal production of or absence of vocal quality, pitch, loudness, resonance, and/or duration. Other classifications of speech disorder. One is stuttering. It's the most common fluency disorder. It is an interruption of flow of speaking. The other one is cluttering, extension of normal speech disfluencies. We have dysprosody, which is alteration in intensity in the timing of utterance segments and in rhythm and intonation. Muteness, complete inability to speak. Articulation disorder, also known as phonetic disorder, characterized by difficulty learning to produce sounds. Physically, sounds can be substituted, left off, added, or changed. We also have dysarthria, weakness or paralysis of speech muscle caused by damage to the nerves. This leads to slurred speech. Aphasia, inconsistent production of speech sounds and rearranging of sounds in a word. Aphasia is a language disorder that is caused by damage to the left side of the brain. This makes it difficult to speak, read, and understand what is being said. In the United States, statistics from the 21st or the early 21st century compiled by the National Institute of Deafness and Other Communication Disorders revealed that approximately 5% of American children had detectable speech disorders by age 6 or 7. About 7.5 million Americans were found to be unable to use their voice normally. Disorders of articulation among children were frequent. Educators should create an environment of acceptance and understanding in the classroom and encourage peers to accept the students with speech impairment. So these are the following teaching strategies and educational programs that are being practiced in our schools today. Practice and maintaining easy and effective communication skills by modeling good listening skills and by facilitating participation of all students in classroom discussion and activities. If a student requires a sign language interpreter or the use of augmentative communication, teachers should provide adequate space and time to accommodate these forms of communication. Some students with severe communication disorders will have deficits with the analytical skills required to read and write. So, individual instruction may be necessary to remediate these deficits, but should be provided discreetly to avoid embarrassment and possible resistance. Teachers should constantly model the correct production of sound, maintain eye contact with the students, then tell her to watch the movement of your mouth when providing direct instruction. Ask her to copy these movements when she produces the sounds. Research study and its findings. The National Academies of Sciences, Engineering, and Medicine research about speech and language disorders in children. This is about the implications for the Social Security Administration's Supplemental Security Income Program. So here are the findings of their research. So they have evaluated first the relationship between risk factors and speech disorders. The parents of 65 children with functional speech disorders and 48 normally speaking controls completed a questionnaire investigating risk factors associated in the literature with developmental communication disorders. The findings indicated that some risk factors, the pre- and perinatal problems, ears, nose and throat problems, and sucking habits and positive family history distinguish speech disorder from normally speaking controlled populations. Developmental disorders are identified when expected functional skills in children fail to emerge. Underlying factors that contribute to developmental disorders are likely to have been present well before the signs are manifest in the children's development. In a 15-year follow-up study of children with speech and language disorders, 52% of the children initially identified with such disorders had residual learning disabilities and poor academic achievement later in life. 21% of all special education eligibility in the United States is for speech and language impairments, 3 times greater than eligibility for autism and intellectual disability. Before we end the discussion, allow me to share with you Isaiah 50 verse 4. We should accustom ourselves to speak in pleasant tones, to use pure and correct language, and words that are kind and courteous, sweet, kind words are as dew and gentle showers to the soul. The scripture says of Christ that grace was poured into his lips, that he might know how to speak a word in season to him that is weary. So, we may not be able to experience speech disorder. And with that, at least, we do our best to always accustom ourselves to speak in a pleasant tone, especially in understanding those children, those individuals who are having the speech disorder, and just be kind to them and just be patient with them, just like what Jesus did. So, again, thank you very much for listening to this discussion, and our topic for this discussion is all about what again? Speech disorder. So thank you very much and good morning, everyone.